think of the core, we want to think of the core as a canister, so a cylinder that is pressurized from the inside and from the outside. And on the top of that cylinder, you've got your diaphragm, which will descend as you take an inhale and then ascend as you take an exhale, or as you exhale normally. On the bottom, you've got the pelvic floor, which will respond or should respond reciprocally to the diaphragm movement and that pressure management. At the front, you've then obviously got your abdominals, your transverse abs, and then your obliques. And at the back, you've got all of your spinal muscle bulk, your paravertebrals, any kind of lumbar fascia. So that forms the whole cylinder that we know as the core. We deep dive a little bit more into what forms the front of that cylinder. So obviously you've got your transabs, which is like this belt-like muscle that sits across the front of your lower abdomen from the two bony prominences that you can find down to your pubic symphysis, and that creates the kind of lower bracing effect of our core. You've then obviously got your rectus abdominis, which is the ones that we traditionally think of as our ab muscles, your six-pack muscles, which its primary role is to form flexion. So it pulls us into that flexed position, so those traditional kind of ab crunches. And then you've got your internal and your external obliques, which form like a sort of cross body either way. We've got two sets that do that and then a set that come. They help to form rotation or stabilize against rotation, and then help forming and stabilizing against lateral flexion. Paravertebral muscles, or your back muscle bulks, essentially do the opposite of all of those. Okay, so you've got equal and opposing forces. To find that core kind of stacked or braced position that we talk about, it's not as big a movement as creating sort of a rigid kind of posture. To start with, I want you to sit. Now, if you slump and then try and take a big deep breath in, you'll find that the air doesn't really go through the front. You might find that you expand through the back of your chest, but there just kind of isn't really a great deal of movement. If you then do the opposite of that and arch, you'll find that a lot of the air comes through to your upper chest, and that again, you're not really moving through your rib cage. If you find somewhere in the middle and then take a big deep breath in again, you'll notice that the air around the rib cage can expand in all directions, and that's what we're looking for. So we're looking for that kind of somewhere in the middle stacked position. That's what we ideally talk about when we think about engaging your core. It's somewhere in the middle. So when we talk about bracing through the core, I'm going to try and demonstrate this for you. We're thinking about pulling those two bony prominences together and pulling up from your pubic symphysis. So sort of imagine you're hugging your guts or your intestines in, or if you're thinking about a pregnancy, you're hugging the baby. So imagine trying to zip up through that core. And what you'll find is that you get a small reduction in kind of waist size or an activation of the muscles around here. So it's the difference between going from a relaxed stage, and if you then activate, you get this tightening through here, this kind of slight shrinking. It's not a massive movement. We're not looking at a lot. So you go from relaxed to then engaged. Relaxed and engaged. And you should be able to breathe and talk and do everything as normal with that engagement. And of course, because everything's connected, you then might find that you get some activation through the back, the lumbar fascia, your paravertebral muscles. So you might notice that other areas change. About adding in those obliques as well. So we zip up through the lower core. If you then put your arms out in front of you and imagine you're reaching away, but don't actually reach through the shoulders. So it's this kind of engagement through the obliques, either side. Think about reaching away. And then can you breathe in and out whilst maintaining both of those? It takes a bit of concentration. It's also worth noting as well, we're not looking for a completely flat back posture here. We're not looking for that scooped under sensation. You probably have your sort of, maybe a blueberry sized or a small area underneath your back, which is your normal lumbar curvature, your normal position for your spine. Okay, so if we're looking to find that same braced position from a seated posture, so we're not looking at really arched, and we're not looking at very kind of flexed and rounded. Somewhere in the middle where your spine is stacked on top of each other. And we're looking to find that engagement, so zipping up through the core. And you might notice that waist changes, so relaxed. And then engaged. Okay, same thing with the arms. locking in the obliques. Think about reaching away, but don't actually reach. And you get that locking in through the obliques and through the core. So that is your full braced position in a seated posture. Okay, now if you were to take that forward to imagine you're having sort of like an overhead press situation. So you think about finding that braced position, so you engage through the lower abdomen, engaging through your obliques, and you want to maintain that as you push overhead. So what we're not looking for is this switching off of your core. Okay, so you should be able to find that core and maintain that whilst breathing, whilst moving to hit that thoracic extension. Looking to do the same thing in a hinge type action, so Romanian deadlift, Bulgarian, any of those kind of movements. You want to look to find that zipping up again, so that engaging through the core, everything's nice and sort of switched on, aware, you've got that bracing position, and all you'd be looking to do is hinge from the hips to maintain that. Send the hips back, keeping that core engaged, breathing in and out with the movement. Typically I recommend breathing in as you compress, breathing out as you extend.